Hey, I'm Dalton from Performx Physical Therapy. Today we're going to go over a quick hip screen that we performed at our grappling injuries workshop, looking at some of the common injuries that we see with restricted hip mobility. We're going to look at external rotation of the hip, which is a quick, easy test. You should be able to lie on your back with your back flat. One hip should be able to come up into this kind of 90 position. And we like to look at two things. One, active rotation. So we should be able to rotate the hip. And we like to see a full 60-degree movement in this hip. So if we start here at 0, we start to come over 45, and we like to see a little bit extra into that 60-degree range. Ideally, we also should be able to get the hip all the way over to about 90 degrees. If we're restricted or tight into this movement, what we'll see when we're training or in the gym is when the hips needs to come into these bigger rotations, we start to see these adjustments happen through the back, which starts to overload the tissues in the back. We can start to get achy, stiff back from that. We also see that movement translate down into the knee, where we start to see a lot of lateral knee injuries come out of this. So if your hips are tight, you should start to open those up. And a lot of times if you have back or knee injuries, the hips are actually the cause. In order to improve that hip extension, we can also start to mobilize that hip to start in order to open it up. So we'll hook up a strong kind of power band around something sturdy, get it really high up into the hip, into the groin. You can do this on the floor or on a table, and we're just going to go into that kind of pigeon pose position like in yoga, where the leg comes down. We want to keep the knee at 90 degrees. If the knee starts to bend, it'll take the load off the hip. So if we can keep the knee at 90 degrees, we'll get a much more effective stretch in the outside of the hip. So the knee should be able to get all the way down to the floor. This back leg will go backwards with the thigh pointing straight down. And what we're going to do is put our hands in front of our legs, and we're going to use a contract, relax pattern to get more movement. So we're going to squeeze the glutes as tight as we can. So clench your butt about 5-6 seconds, and then you're going to relax and then sink your chest a little bit further down into the stretch, which will increase the stretch in the hip. From here, we're going to repeat. So we'll squeeze the glutes tight as you can, again, about 5 or 6 seconds. And then we're going to relax and then start to sink the chest a bit further down. And we're going to repeat this 10 times, or about a minute of time under tension, getting the chest as far as we can down. And we can start to twist towards the hip as well, which winds up the hip just a little bit further. After that, we come off, retest the hip. Should feel a little bit lighter, a little bit looser, and that should start to open up that rotation in your hip for you. Thank you so much for coming to the workshop and checking out these exercises. Remember, these are the tools that start the process in order to make a longer term change. They'll help open up your range of movement like we want, and then we want to strengthen and make that long-term change to that range of movement. So it's that first step in the process. If you're struggling with any of these movements or restrictions, come and visit us. We can help you out and show you exactly what you need to do to improve it.